how are you this morning?
Good, how are you?
Good. My name is Sarah. I'm going to be your CRNA student today. Can you tell me your name this morning?
Corey.
Nice to meet you, Corey. So today we're just going to be doing a full head-to-toe assessment. Have you had one of those done before?
I think so, maybe.
Okay. So this one's going to take about an hour, so it's pretty lengthy. Do you need to go use the restroom or anything before we get started? Okay. All right. So first I'm just going to talk about your original survey. So that's commenting about your appearance today. So you're erect in bed. She's dressed appropriately for the weather. She has good hygiene. And then do you have any mobility issues that you know of? Okay. And I saw you walk in and you didn't have any issues walking in either. All right, can you tell me where you are today?
Baptist Health.
Good. And where are we here?
Physical.
Good. And what year is it?
2025.
Okay. So she's already home sport. Speech is clear and spontaneous and no issues there. And I'm just going to do some vital signs assessments on you. And before we do that, I have one more question for you though. If you were to see blue lights coming behind you, what would you do while you're driving?
All over.
Okay, awesome. So then I'll do your vital signs. So I check your temperature, your heart rate, respiratory rate, and blood pressure. And then I would record and document that. Okay? So next we're going to do an assessment on your head, if that's okay. So first I'm just going to look around here. So skull looks normal cephalic. Head is symmetric, face is symmetric. Go ahead and make a big, exaggerated facial expression. Maybe stick out your tongue. Okay, so cranial nerve 7 is intact. I'm just going to feel your joint here. Open and close your mouth for me. Perfect. Any pain there? So there's no crepitus or popping or clicking or no pain on your TMJ. Go ahead and clench your teeth for me. Okay, so cranial nerve 5 is intact there. Okay, go ahead and close your eyes for me too. Tell me if you feel sharp or dull sensation here.
Sharp.
Okay.
Dull.
Okay, so those are sensation on her face, so that cranial nerve 5 is intact as well there. Okay. I'm just gonna feel your scalp here if that's okay too. Okay. So I'm palpating the scalp. The scalp looks well nourished, hair's well distributed throughout the scalp. I'm not feeling any lesions or bumps throughout the scalp. Okay. So now I'm going to palpate your sinuses here. So I'm going to do your frontal. Tell me if there's any tenderness or pain there. No. Okay. And the maxillary.
No pain.
No pain. Perfect. Okay. So now I'm just going to take a look at your eyes. Okay. So close your eyes for me. Looking at your lids here, inspecting them. They are clear. There's no lesions. They're clean. And then looking at her lashes, they're evenly distributed. They're clean as well. Okay. Go ahead and open your eyes. Sclera are white, no redness present. I'm going to pull your lids down and then check your conjunctiva there. Okay, so conjunctiva is pink and no redness there either, and they're moist as well. Perfect. Now I'm going to check your vision. I'm going to have you hold this card about 12 inches away from you. Cover your left eye first, and read the lowest line that you can on that card.
4, 2, 6, 7, 3, 9.
Okay, so vision is 20/20 in the right eye, so cover your right eye and read the lowest line you can again there.
4, 2, 6, 7, 3, 9.
Perfect. Vision is 20/20 in the left eye. And then with both eyes open, read the lowest line you can.
4, 2, 6, 7, 3, 9.
Perfect. Vision is 20/20 with both eyes open. Now I'm going to take a look at your pupils. Just going to get a size on them first. So they are 3 bilaterally and they are round and equal bilaterally. Just going to turn the light on. It's going to be a bright light and I'm going to check your pupil accommodation here. And they both react to light there. Now I want you to take a look at my pen light and then look at the wall for me. Perfect. And then accommodation is present and equal bilaterally. So pupils are purple. Okay. I'm going to check a red light reflex here. So it's going to be a little light here. Red light reflex is present in both eyes. Okay, so now I'm going to check cranial nerves 2, 3, 4, and 6. So first I'm going to have you cover your left eye and tell me when you can see my hand come into your visual field here.
Now.
About
Now. Now.
Okay, cover your other eye. Same thing.
Now. 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 Now.
Okay, so visual fields are normal and equal. So now I'm going to have you follow my pen light with your eyes. So we're doing the cardinal movements of the eyes here. We're going to check for nystagmus, and no sinus present here. Alright, so now I'm going to look at your nose here. So nose is symmetric, it's midline in her face. The nares are patent, and then they're also symmetric and equal. So now I'm going to have you cover your left nostril. Take a big sniff in. Okay, other side. Cover it, big sniff in. Nostrils are patent. Okay, go ahead and close your eyes for me. Cover your left nostril, or close it. Okay, and then tell me what you smell.
Alcohol.
Okay, and then cover your right, and then tell me what you smell.
Alcohol.
Okay, cranial nerve 1 is intact there. Now I'm going to take a look at your ears. So first I'm going to inspect here. So they are clean, no lesions present. I don't see any bumps or anything like that there. So now I'm going to palpate the pinna here, the tragus, and the mastoid. Any tenderness there? Okay. So same thing on this side. I'm going to inspect. It's clear as well. No lesions or bumps. I'm going to palpate the pinna again, the tragus, and the mastoid. Any tenderness there? Perfect. Now I'm going to take a look with the otoscope here. I'm just going to pull your ear up and back, okay? So the ear canal is clear. There's no redness or signs of inflammation. And then tympanic membrane is pearly gray. And then there's a positive light reflex there. And the same thing on the other side here. Up and out. And this ear canal is clear. There's a little bit of earwax in this one. It's pink, no signs of inflammation. And then the tympanic membrane is pearly gray. And then a positive light reflex as well. Okay, so now I'm going to test cranial nerve 8. So I'm going to have you cover your left ear. I'm going to whisper 3 words, and I want you to tell me those back, okay?
Car, truck, tractor.
Okay, so cover your right ear. Same thing here.
Pink, blue, green.
Awesome. Okay, so whisper test is great. Cranial nerve 8 is intact. Okay, so now I'm going to go to your mouth here. Now I'm just going to assess your mouth. So lips are, there's no lesions, they're moist, pink. Just looking in here, I'm going to get the tongue compressor here. Ready? Okay, so come down, I'm going to inspect her soft palate, her tongue, look at her cheeks, her gums, her teeth. So her soft palate is pink, gums are pink and moist, teeth, there's no caries present, they're white, all are present. Go ahead and stick your tongue out for me, move it side to side, perfect. And then tongue is midline, there's no lesions on it either. Then we're going to, go ahead and say ah for me, stick your tongue out and say ah. Okay, so uvula moves with saying ah. And then I would assess a gag reflex at this point by touching the uvula with a Q-tip. And then I'm going to assess a swallow. So I'm going to give you a sip of water. While you do that, I am going to check your thyroid too. So go ahead and tilt your head back a little bit. Okay. Perfect. Okay. So swallow is intact and present, and then thyroid is normal in size and moves with swallowing. So now we are going to move on to the neck. Okay, so first I'm going to inspect the neck. It is clear, no lesions present there. I'm going to listen to her carotid arteries for bruits first with the bell. There's no bruise present there. I'm just going to feel your trachea here, okay? Trachea is midline. I'm going to feel your carotid arteries here. Okay, that's a 2+ on the right, on the left. And then a 2+ on the right there. Okay. sorry, my computer's messing up. Okay. Let me make sure it's charging. Sorry. Yeah, it is. Okay, so now I'm going to assess your lymph nodes. So we got, tell me if there's any tenderness here, okay? So preauricular, postauricular, occipital, we've got tonsillar, submandibular, submental here, then we have supraclavicular, any tenderness there, okay? Then we have cervical, we got our deep cervical chain, we got our posterior cervical. Okay, none of those are inflamed, they are normal as well. Okay, so now I'm going to move to your upper extremities here. I'm just going to look at them first. I'm just going to flip them out for me. Flip them down. Perfect. Okay, so they are normal color distribution. There's no lesions present. All right, go ahead and squeeze my hands for me. Perfect. So grips are equal bilaterally, 5 out of 5. Just going to feel your pulses here. Okay, so they are both at 2+ and equal. Okay, and those are 2+ and equal as well. All right, I'm going to have you pull against my hands towards you. Good. So muscle strength is 5 out of 5, and her muscle tone looks adequate for her age as well. There's going to feel for warm. Alright, so skin is warm. Any tenderness there? Okay. Alright, I'm going to have you bend your elbows like this. I'm going to feel for any crepitus while you do that. She has full range of motion, no crepitus. Okay. And then I'm going to have you bend your wrist up and down. Full range of motion in the wrist, no crepitus there too. I'm going to check your capillary refill here. Perfect. It's less than 3 seconds in the right hand. Less than 3 seconds in the left hand, and then nails are angled correctly. No abnormal angles there. Now I'm going to do your back here. Okay. First thing I'm going to turn around. So I would inspect the skin on the back if she were to be in a hospital gown. I would look for any lesions, any discolorations, any bruising, wounds, anything like that. I'm just going to assume that she does not have any of those present here. So now I'm going to auscultate the 10 areas. So big deep breath in and out of your mouth for me. And just do that every time I move. Perfect. Lung sounds aren't clear in the posterior back, and equal bilaterally, and all lobes as well. Okay, so now I'm just going to feel your spinous process here, and then your paravertebral or muscles here too. So the spine is midline, and then the paravertebral muscles are normal for her age as well, and they're all present. So now I'm going to percuss all of the 10 areas as well. So those are all equal in all 10 areas as well. Now I'm going to check for CVA tenderness here. Any tenderness there? Okay. So no CVA tenderness present either. Okay. So now I'm going to assess the anterior chest here. So if she were to be in a hospital gown, I would have her, I would lift it up and assess the skin. I'm not going to do that today. I would assess for warmth or for lesions, color, any abnormalities there. There's none that I can see from the V-neck of her shirt though. So now I'm gonna listen to the front of her lungs here in the 8 spots. Do deep breath in out of your mouth. Here. And by looking at her AP diameter is 1 to 2. She has a normal rate of breathing, it seems, and then her rhythm is unlabored, it's normal. No tachypnea present. Now we're going to move on to your abdomen. So if you want to lay back there, and then yeah, we'll have your legs slightly bent there. I'm not going to uncover her now, but for a normal patient, I would. So first, I would lift her shirt up. I would assess her abdomen. I would look for any pulsations, any heaves. I don't see any of those present here. And then her abdomen is flat. It's not concave or convex. I don't see any pulsations. So now I'm just gonna listen to her aorta here for a bruit. Okay, I do not hear a bruit present. I'm gonna listen to the 4 quadrants here. Bowel sounds are normal active. So I'm just going to percuss your abdomen, okay? Tell me if there's any tenderness there. Okay, and it's tympanic throughout. Now I'm going to check for some rebound tenderness, okay? So I'm going to press down. Okay. Any tenderness there? So no rebound tenderness present. Now I'm going to palpate for her liver. Okay, liver is not palpable there either. Okay. So now I'm going to palpate the quadrants here. Tell me if there's any tenderness. So first I'm going to do light palpation. Any tenderness. Okay, I feel no masses, bulges. Nothing there. So no tenderness present with light palpation. I'm going to go with deep palpation. No tenderness. Okay. Okay. No tenderness present there. I'm going to auscultate her renal arteries and her femoral arteries. Renal first. Also going to check for a bruise on her renal arteries. Okay. And in this video, I'm not going to assess her femoral arteries, but I would listen with the diaphragm anvil to her renal arteries, or to her femoral arteries, and then I would also palpate her arteries. They should be a 2+ bilaterally, and then so I'm going to have you lift your head up, and I would assess for a hernia with any diastasis recti present there. Perfect. So there's no hernia present. Great. I'm going to have you sit up. Okay. So now I'm going to listen to your precordium here. First, I would assess the skin. There's no lesions present. That would be normal. So first, I'm going to take a listen. We're going to do diaphragm anvil. So our aortic area, second intercostal space, right sternal border. And we got pulmonic. And that's second intercostal space, left sternal border. We got Erb's point. That's third intercostal space, left sternal border. Tricuspid valve. That's fourth intercostal space, left sternal border. And then we have a mitral valve. Sorry. That's fifth intercostal space, mid-clavicular line. Right, and then I'm going to auscultate her apical pulse for 1 minute. Okay. My computer keeps dying, I'm sorry. Okay. Alright, so I'll auscultate her apical pulse for 1 minute there. I'm also going to do it with the bell as well. So aortic, pulmonic, herbs, tricuspid, and mitral. There are no bruits present, no murmurs present. S1, S2 is noted at each point as well. And then her rhythm is normal and rate is, or the rhythm is regular, rate is normal as well. Okay. So now I'm going to go to your upper extremity lymph nodes. Okay. So we're going to have our central here. You tell me if there's any tenderness with this, okay? We got central, we got lateral, okay. Got subclavicular, subscapular, and then pectoral. Any tenderness there? Okay, so there are no lymph nodes enlarged in your upper extremities. We're going to do the same thing over here. So central, lateral, we got pectoral, subscapular, and then clavicular here. No tenderness there. Okay. So there's no palpable lymph nodes on the left side either. Okay, so now I'm going to take a look at your lower extremities. So first I'm going to inspect for color. The color is evenly distributed. There's no lesions present there. I'm going to feel for warmth here. Okay, so skin is warm to the touch. Okay, I'm going to check for edema. Okay, so there's no edema present. I'm going to have you push down against my hands for me. Good, and then pull up towards your head. Okay, so muscle strength is 5 out of 5 bilaterally. Now I'm going to check for pulses here. So we're going to do posterior tibial and dorsalis pedis at the same time. Okay, so there are 2 plus equal bilaterally on the left, 2 plus equal bilaterally on the right there. Okay, I'm going to have you bend your ankles down and up, down and up. Okay, full range of motion in the ankles. Same thing with your knees, down and up there. Perfect. I'm actually going to feel for any popping or something, anything when you do that. Okay, go ahead and do the other side again. Okay, so there's no crepitus there, and the same thing for the ankles. Perfect, no crepitus there. Can you do that with your ankles? Perfect. Okay, I want to do that with your wrist too, because I can't remember if I checked your wrist. Range of motion. Go ahead and down, up, no crepitus, and then do the full range of motion. Perfect, full range of motion of the wrist. Okay.
You may take my socks off.
Yes, please. Okay, so now I'm going to check for capillary refill on the toes. Okay. Alright, so all toes are less than 3 seconds for cap refill. And now the nail angle is normal as well for her age and all that. So that's my one. Okay, so now I'm going to have you shrug against my hands for me. Shrug your shoulders. Good. Down, up, and down. Okay, and then turn your head against my face, or against my hand. Turn your head against my hand. So that is cranial nerve 11 is intact. Okay. At this point, I'm going to take a look at my notes and make sure, see if I'm missing something so far. I'm gonna assess for cranial nerve 8 with the hearing. So I take it, if I had a tuning fork, I would take a tuning fork. Sorry, I'm gonna push this down a little bit. There we go. I would take a tuning fork. So we're gonna do the Weber test first. So I would activate the tuning fork, place it in the middle, and I would ask the patient, can you hear that? Yes. Okay, and tell me when it stops, and she would tell me when it stops. Okay, and then same thing for the Ryan test here. I'll do it bilaterally. So I would hit the tuning fork, put it against her ear. Can you hear that? Okay, and then tell me when it stops. And she would tell me when it stops. And then that would assess for cranial nerve 8. Okay, so now I'm also going to go to her back. I'm going to feel for expansion as she breathes in and out. Okay, so the rib cage expands symmetrical as she breathes. Okay, and then I'll also do a breast exam on her if we were in a real exam. So I would inspect the breasts for any dimpling, any nodules, and then I would have her put her arms to her side, assess for dimpling at her hips, and then above her hands, assess for dimpling. Now I'll palpate at the nipple, make sure there's no lesions inside there as well. And then I would teach a self-breast exam, and I would teach her to do it in the shower after her period, and I would have her do it lying down and standing as well. And then I would demonstrate how to do that for her as well. So now we're going to move on. I'm going to have you stand up for me. Okay. So shoulders and iliac crest are in line and symmetric. I'm going to test your range of motion of your cervical spine. So look down for me. Right. Then look up. Then side to side. Okay. Then pull up with your shoulders for me. Okay. Awesome. So 5 out of 5 on her trapezius muscles. Okay. And then turn to your right again and push against my hand. Okay. And then turn to the left and push against my hand. Okay. 5 out of 5 on her sternocleidomastoid muscles as well bilaterally. Okay. So I'm going to have you bend over and towards the ground and assess for any scoliosis present. Okay. So her spine is straight and midline, so I don't see any signs of scoliosis there. I'm going to have you take a little walk for me. Awesome. Okay, and you can come back. Gait is steady, well balanced. Spine, again, shoulders and iliac crest were midline as she walked. Okay, I'm going to have you first close your eyes. I'm going to perform the Romberg test here. Close your eyes and just stand still, and I'm going to provide some support here in case she does fall. Okay, so you can open your eyes. Normal Romberg test. She stayed upright the whole time. So now I'm going to have you stand on one foot and just stand there. Perfect. We're going to hop in place. Great job. So that was all normal as well. Okay, so now I'm going to have you sit back down for me. I'm going to assess your reflexes. Okay, so first we're going to do the brachioradialis here. So, okay, okay, so that was a 2+ on the left. Perfect, 2+ on the right. I'm going to do the this one. Okay, 2+. Perfect. And then we've got this one, 2+, this one, 2+. And we got the teller here, 2+. Perfect. So now I'm going to assess with my tuning fork on her joints to see if she can feel it. So I activate the tuning fork. I'll hold it against her joints. Can you feel that? Can you feel that? Same thing for elbows. Can you feel that? Can you feel that? Knees, ankles as well. Okay. Then I'm gonna have you close your eyes for me. I'm going to place an object in your hand, and I want you to tell me what it is. Okay. So what is that?
A pen.
Okay. And then we're going to do... What is that?
A paper clip.
Perfect. So serotonesis is normal in both hands. Okay. Keep your eyes closed for me. I'm going to write something in your hand and tell me what it is, okay?
A.
Okay. Y. Okay. So graphesthesia is normal in both hands as well. Okay. You can open your eyes now. at my notes one more time. So, I'm going to assess for NUR 12 now. Go ahead and stick your tongue out for me. Move it side to side. Okay, perfect. Alright, so NUR 12 is intact there. I'm going to look at her lower extremities as well. There's no varicosities present here, so no varicosities there. Alright, I'm going to do sensation testing on you as well as your Babinski reflex here. So, first we'll do the Babinski. Just going to pull this along your foot. Okay, so negative Babinski bilaterally there. Okay. Have you close your eyes for me? I'm going to tell me if this is dull or sharp touch, okay? So first we're going to do your right extremity.
Dull.
Okay.
Sharp.
Okay. I'll go to your left.
Dull. Dull.
Okay. I'm going to go to your lower extremities now. Move your hands there, okay? Same here.
Sharp.
Okay.
Dull. Sharp. Dull.
Perfect. Okay, so now we're going to do fine motor movement. I'm going to have you do the rapid hand test there. Perfect, so that is normal. And I'm going to have you touch your finger to my finger and then to your nose. Perfect. Okay. Okay. And then if she were to be a male, I would do the male genitalia assessment. So I would inspect the scrotum, penis for any lesions, edema. I would open up the urethra. I would inspect that as well. I would palpate the epididymis and the scrotal sac for any lesions there too. And then I would teach the genitalia assessment or like a self-assessment to the male as well. All right. Well, thank you for your participation today, and I hope you have a good day. Bye. See you. Let me wash my hands first.